Today, we're covering important pediatric conditions that nursing students need to know. From orthopedic disorders like clubfoot and hip dysplasia to gastrointestinal issues like GERD and pyloric stenosis. Let's start with clubfoot. This is a congenital condition where the baby's foot appears twisted out of shape or position. The cause can be idiopathic, syndromic, or positional. Key deformities include cavus, a high arch, adduction, forefoot turned in, varus, heel turned inward, and equinus, foot pointing downward. Complications can include abnormal gait, difficulty bearing weight, and even a rocker bottom foot if untreated. Treatment involves gentle manipulation and serial casting, typically replaced every 5 to 7 days. Always monitor skin integrity, check color and temperature, and keep the cast clean and dry. After casting, a brace is worn up to 23 hours a day for months, then just at night for a few years to prevent relapse. Now let's talk about developmental dysplasia of the hip, or DDH. This is when the hip joint is unstable or misaligned. It's diagnosed with 2 main tests: the Barlow maneuver tests if the hip can dislocate. The Ortolani test checks if it can be reduced back into place, often heard with a clunk. Infants may have a shorter leg on one side or uneven thigh creases. Toddlers might show a waddling gait. Treatment may include a Pavlik harness, surgery, or a spica cast. Next, we have Duchenne muscular dystrophy, a genetic disorder causing progressive muscle weakness, mostly in boys. It starts around age 3 to 5 with frequent falls, trouble climbing stairs, and a waddling gait. A hallmark sign is Gower's sign, using the hands to walk up the body when standing up. By age 12, many children lose the ability to walk. Respiratory infections are common and often life-threatening. Supportive care includes glucocorticoids, physical therapy, and sometimes a pacemaker. Now on to gastrointestinal conditions. GERD, or gastroesophageal reflux, happens when stomach contents move back into the esophagus. Babies might cry inconsolably or arch their backs after feeds. Older children may complain of heartburn. Tips to reduce symptoms include smaller, more frequent feedings, burping during feeds, holding the baby upright, adding rice cereal to formula, monitor feeding patterns and growth closely. Another condition is pyloric stenosis. It usually shows up between 2 and 8 weeks of age with non-bilious projectile vomiting. Look for a palpable olive-shaped mass and signs of dehydration. Treatment is surgical, but first, correct any fluid and electrolyte imbalances. After surgery, start clear fluids slowly and watch for vomiting or poor intake. Intussusception is when part of the intestine slides into another, like a telescope. Signs include severe, crampy abdominal pain, red currant jelly stools, vomiting, a sausage-shaped abdominal mass. Initial treatment may involve a contrast or air enema. If that doesn't work, surgery is required. Now let's go over celiac disease. It's an autoimmune condition triggered by gluten, which damages the intestines. Symptoms in children can mimic ADHD or autism and include delayed growth, irritability, chronic diarrhea, and rashes. There's no cure, just a strict gluten-free diet. Avoid wheat, barley, rye, and many processed foods. Always read labels. And lastly, a serious neonatal condition, necrotizing enterocolitis or an EC. It's a life-threatening disorder, mainly in premature infants. Watch for signs like bloody stool, feeding intolerance, and a distended abdomen. Immediate care includes stopping oral feeds, decompressing the stomach for fluids, antibiotics, and sometimes surgery. Let's do a quick recap. Clubfoot requires serial casting and bracing. DDH is diagnosed with Barlow and Ortolani maneuvers. Duchenne MD causes muscle weakness and Gower's sign. GERD in babies improves with positioning and feeding changes. Pyloric stenosis causes projectile vomiting and needs surgery. Intussusception shows red jelly stools and may need an enema or surgery. Celiac disease requires lifelong gluten avoidance. An EC needs rapid response and sometimes surgical intervention. Thanks for learning with us today. Remember, pediatrics requires close observation and early intervention. See you in the next lesson.